Well, welcome back, ladies and gentlemen, to our 40th patient event. So our next speaker is Kathrine Parker, renal pharmacist. Now, Kathrine works at the Manchester University NHS Foundation Trust. We'll be looking at the role of the kidney pharmacist and talking about a 3-year study she started last year. Kathrine.
Thank you, Pete. So as Pete said, I'm a specialist kidney pharmacist at Manchester, and I've been in that role for the last 12 years nearly. So what I'm going to talk about, I'm just going to talk a little bit about what your kidney pharmacist does. So some of you might have different experiences with your kidney pharmacist. Some of them might know them quite well. Some of you might not know them very well at all. So I just want to kind of let you know kind of what we do, how we can help you to ensure you're on the kind of best treatments, and the journey of my role and how kind of patients have helped me kind of shape my role over the last 12 years or so. So if you actually put into Google what is a pharmacist, I think this is kind of a lot of the perception, and probably the most kind of contact that patients in the community have. So somebody who's based in a dispensary with lots of packets of medication. Now in hospital, we find that actually we're very much kind of ward-based, and we work very much with your kidney team, with the doctors, the nurses, and all the other staff involved in your care. So it's very different. Also, we see kind of a different population. So patients in hospital tend to be a bit more poorly, and there are lots of different drugs compared to what you might see in the community, such as drugs that are administered into the veins, and we get involved with providing advice on how to administer things safely into the veins, what kind of doses, how quickly, and supporting nurses on making these up to the right strength to make sure that they're stable. And that might be something as simple as what to mix it up with. So if you put it in a bag of sugar instead of a bag of kind of salty water, that might make it kind of all precipitate into big lumps. And also what's potentially very key with kidney patients is in somebody who's very fluid restricted, looking at how we can actually administer drugs in the vein at the smallest possible volume to prevent kind of fluid overload. And this is just an example of what could happen into the kind of tubing if it wasn't mixed up properly. So hospital pharmacists tend to specialise in kind of different areas, and I've been a specialist kidney pharmacist for the last 12 years. Things that people probably don't see are we get involved in developing guidelines. So we work with the kidney team to develop guidelines to help kind of standardise care for our patients, and also support kind of new staff on the best way of kind of doing things and using medications as well. We do audits to make sure that we're using medicines safely in our patients. And you might see us on the ward rounds with your kidney team, kind of supporting them, making kind of general prescribing decisions about medicines. And we will discuss with you or your carers about changes to your medicines and things that are going on with your medicines when you're in hospital. Now, I've certainly worked with my local kidney patient association to develop patient information for our kind of local patients. And I also get involved in education of our doctors and other renal staff. So I teach on a course at the University of Manchester for renal nurses. And because we all know that, you know, kidney patients aren't always included in some of the big kind of pharmaceutical studies when they're testing new drugs, we find it more difficult sometimes to kind of identify what are the best treatments for kidney patients. So we work with the team together to kind of look at what evidence or data there is to kind of come up with the kind of best treatment plan for that patient, and then discuss with the patient the options that we have. I'm thinking about planning medicines timing in relation to dialysis. So should it be given before or after? Do we need to give extra doses? I just thought I'd give a few examples of how we might get involved in your care. So this was a patient who had just started hemodialysis, and they were newly diagnosed with an allergy to heparin. So as most of you will know, we use heparins to kind of stop the circuit clotting up. So it was kind of, what are we going to use now? Looking at our options, what's going to be the safest, and then kind of putting that plan in place. So we had to work with the nursing team because special monitoring was needed. The medical team, because we don't use it very often, making sure we kind of got the right dosing strategy, and also making sure that the dialysis unit was able to get hold of some of the drug. Another example, so at Manchester, we're quite fortunate that we have a dedicated kidney transplant patient phone line. So kidney transplant patients can ring us up with their questions. So this is a patient who's got a urinary tract infection, and their GP started them on trimethoprim, and they're just wondering whether this is appropriate. So we can get involved in calling the GP to discuss kind of what results they've got. Is there any kind of alternative antibiotics that we could perhaps use? In some cases, trimethoprim wouldn't be the most preferable antibiotic, but it depends on the options. So then we were able to work with the GP and recommend a different antibiotic. So they were able to send the prescription that the patient could take. Obviously, during COVID, lots of things have changed. So the way we work, certainly within our kidney transplant clinics and some of our other clinics, is, making sure that patients have actually got supplies of their hospital only medicines. So that might have been, we actually started posting medicines out to patients on a more regular basis, or doing a kind of collection point where patients could collect medicines to make sure that they don't run out of essential supplies. So these are things like the kidney transplant anti-rejection medicines, patients on tolvaptan, and also making sure they had, the blood test to make sure it was safe to give them, and that might have been organising those more locally to their home. Supporting delivery of the COVID-19 vaccines in some of our clinics, and also across the dialysis units to make sure that dialysis patients had very, urgent access to those kind of vaccines, and that we kind of got that rolled out quickly. And reviewing ongoing kind of treatment recommendations and changes that were happening throughout the pandemic. So there might have been different recommendations for certain conditions. One drug might have been preferred over the other because of less hospital contact. And so adapting to kind of all these changes that were going on as well, making sure that the safest and most appropriate treatments were available for our patients. So where you might see your kidney pharmacist, so this is probably nationally where you might find them. Some units have dialysis unit pharmacists who provide a medicines review and advice service. So you might see them on your unit. Your renal ward, when you're in hospital, discussing with you around different changes and supporting kind of decisions. In clinics, so at Manchester we're just involved in the transplant clinic, but there are other trusts who work with kidney patients on tolvaptan, who work in anemia clinics, and who work in some of the kind of autoimmune kidney clinics, looking after patients kind of immune suppressant drugs. Or you might find us kind of working collaboratively, developing patient information, or as part of kind of research. So what can your kidney pharmacist help you with? So I get quite a few questions actually on vitamin supplements, over-the-counter medicines and herbal kind of products. And this is data from a German study, which was quite surprising to me actually, how high the use of vitamins were in patients with CKD stage 4 and 5. Now, this wasn't prescribed vitamins. These were vitamins that patients were kind of buying themselves, because there are some vitamins that potentially can't be taken in kind of the more advanced kidney disease. And actually 5 to 6% of patients were taking herbal or supplements as well from kind of health food shops. So there was quite high usage, which was quite surprising to me. So some of the things I've been asked about in my role, certainly a few years ago, there was a big rage about CBD oil. I was getting kidney transplant patients, dialysis patients. Can I use this? So they're very difficult kind of herbal medicines because they're not regulated like medicines. So we know exactly what's in some of our licensed medicines, but it's very difficult to know the amounts of things that are in some of these kind of herbal products. And when I looked into it, I found some information that perhaps it could affect the way the body handles certain drugs, such as tacrolimus, cyclosporin and tolvaptan. So that kind of raised concerns with our transplant patients and some of our kind of rare kidney patients who might be taking these drugs. The other issue is can be some active cannabis in this product, which relies on the kidneys for removal. So the more severe the kidney disease, the more potential for some of the side effects, including kind of some of the mental side effects and sleepiness. And one of my colleagues who's worked down in London, she's actually got some data from a couple of patients who took CBD oil who were kidney transplant patients, and the levels of tacrolimus kind of became erratic, and when they found out it was the oil and they stopped it, they kind of came back to normal again. Another thing that's kind of become more popular is turmeric, and again some of the data says it can affect the way the body handles things like tacrolimus and cyclosporin. Now, I'm not talking just normal amounts of turmeric that you might use in your cooking, something that you do kind of day in, day out. I'm talking kind of very big doses, or some of the capsules you can buy, and we have had patients using the capsules that it has actually increased their tacrolimus levels. Things over the counter. So I do get quite a few questions about the use of ibuprofen gel. So it's very individual decision. It might depend on the patient. Occasionally we do use it very short term, but we would do that in conjunction with the team and kind of make a decision as a team about how appropriate that was. And I get lots of questions about cough and cold medicines because we know that some of them contain ingredients that can affect blood pressure. And the problem is there are so many medicines out there, it's difficult to know which one's which. So I would always suggest speaking to your kidney pharmacist or your kidney team before kind of taking anything herbal particularly, or over the counter. And we do also get involved in providing vaccine and travel advice for people going on holiday. Obviously, at the minute, that's probably been much lower down on people's priority lists. So how does the kind of kidney patient data kind of help us to kind of support you with your medicine? So we actually undertook some local data in our dialysis patients and found that patients who were on our in-centre dialysis were taking 16 tablets every day. Now, I think that's really important for us to understand that the actual kind of effect that might have on somebody's life. And patients were describing to me, I feel like I would rattle if you shook me because I take that many tablets. And a French study looking at non-dialysis patients found that patients with CKD or CKD 3 or 4 were taking on average 8 tablets a day. And they actually found that over 2 years, nearly 20% of these patients were experiencing side effects from their medicines. And some patients were having lots of side effects, more than kind of just one. So I think it kind of, raises the concern to us. We need to be aware of kind of the significant amount of tablets. So we really need you to kind of let us know if there's certain tablets that you started that you're really kind of struggling with, they make you feel terrible, you're not taking them. If you think you're getting side effects from your medicines, please let us know, because we need to work with you to find the actual kind of best treatment for you. And certainly, if you don't know why you're taking a certain medicine or what the benefit of it is, then please ask that, because it makes it very difficult for you to want to take something when you're not really sure what it's for or what the actual benefit is. This is just a little bit of local data, a little sample of when I was doing some dialysis reviews from 22 patients, and we actually found, because I was doing kind of direct questioning, going through medicines and actually spending time with patients, talking about their medicines properly, allocating, specific time to go through all this, we actually found that I managed to stop at least one group of medicines per patient. So that may have been more than one tablet a day. And we identified that actually patients weren't taking at least one of the kind of tablets they were supposed to be taking each day. Some patients were taking things they shouldn't have even been on. And nearly a third of patients were experiencing kind of side effects from their medicines, but they hadn't kind of alerted this to anybody. So maybe it's us as well. Maybe we need to be a bit more kind of vigilant about these things, but please kind of highlight these things to us, because what can happen is you get into a prescribing cycle where you start things that actually are just to treat a side effect rather than treating you. So how have patients shaped my work over the last 10 years? So they've had quite a big influence on my role in transplant clinic. I get lots of questions from patients, and it's led us to kind of start developing different information that we can hand out to our patients in clinic on common questions. Just from talking to some of my kind of older kidney transplant patients on the ward, some said they felt like they missed their friends from dialysis, and I felt like they were staying in a bit longer than some of their younger counterparts. So I actually did a kind of small research project looking at how often they came into hospital, their infections. And what we found was we had very high levels of drug toxicity in our older kidney transplant patients, and this was leading to admissions in quite a lot of them. So we've actually changed our kind of anti-rejection regime for that kind of population. But I think what it really highlighted to me is we know there's the survival outcome data there for older kidney transplant patients, but what about quality of life? I think it would be really interesting to actually look at the actual how patients feel after they've had a transplant and the actual impact on their life. So over many years, we've kind of developed these more effective kind of dialysis machines, and there's uncertainty as whether they remove more drugs. And actually, some patients were saying to me, I feel like I'm kind of withdrawing from my painkiller medicines when I'm on dialysis. Like, it's a really strange kind of feeling. So I undertook a small study with the University of Manchester and one of our nephrologists, and we've kind of looked at kind of what happens to the dosing of these drugs and the levels during a dialysis, and we're just in the minute kind of analysing that data at the minute. So a difficult area for me, my practice has always been kind of blood thinning drugs, because lots of patients tend to need them because they're at higher risk of having kind of clots, but they're also at higher risk of having bleeding. And a lot of the drugs we use aren't studied in kidney patients. And I think what I find really frustrating is there's lots of information out there for people with normal kidney function when starting these kind of medications, but we just don't know what to tell our kidney patients. We don't have the information. So what I'm currently doing is I'm undertaking a research project, which is funded by the National Institute for Healthcare Research. And I'm working with a professor of kidney medicine, a consultant in blood disorders or haematologist, and a pharmacist from the University of Manchester. And I've got a fantastic kidney patient who's helping me, who's this topic is very close to his heart, and he's been fantastic throughout the process. So the overall plan of this work is to develop a national guideline with some kidney patient documents in there, and I'll talk about that in the next slide. Now, I have had support from my local kidney patient research group, and they provide me with some fantastic ideas and feedback. I'm also working with the Devices for Dignity, and they have some PPI patients that can support me, and I had some assistance from a patient advocacy officer from Kidney Research UK when we were looking at starting the project, just to do some scoping work to see what patients thought. So what the study, the patient kind of part of the study is going to be undertaking some online focus groups, or kind of just some online discussions with kidney patients who have ever kind of taken blood thinning drugs or are currently taking them now. So that might be warfarin or apixaban or rivaroxaban. And what we really want to kind of understand is their experience of kind of what information was provided when they started these drugs. Was there anything they felt could have been done better? And what would other kidney patients who are going to be starting these drugs in the future want to know? And can we kind of develop something to help support patients when making these decisions? And it's all about kind of developing information to support discussions between the team and the patient. So this study is kind of raring to go. So if anybody does feel they would like to have their say on this topic, then I've just put my email on the last slide. So please do get in touch if you think this is something you would really like to have your say on. Thank you.
Thank you, Kathrine. Well, such an important role, but one we've never touched on before at NKF conferences. I'm really glad we did today. So Lisa has just put on the chat, thank you very much for highlighting the use of herbal supplements. I think it's really important that it should be discussed more with kidney patients. I know you spoke about that. What's your thoughts on that?
Yeah, I think since I read that paper, I've actually started asking kidney patients more about whether they've considered herbal supplements or whether they actually take anything. We try to do that in our role anyway, but I think I always assume kidney patients wouldn't do that. But I think that it's word of mouth, like lots of people get talking, oh, this has been really beneficial for me. And I think it's thinking about it, isn't it? Like the impact it might actually have on your kidney medicines, particularly the transplant medicines. That is a potentially big impact, isn't it?
Yes, definitely. So would it still be okay to take vitamin B and C, Hope has asked, and she's a dialysis patient?
Yep, so we give vitamins. We do give specific vitamin supplements to most of our dialysis patients, and that would contain things like vitamins B and C. The main ones to worry about are things like vitamin A and taking too much vitamin D if it's kind of above and beyond the recommended levels, and depending on what other kind of vitamin D that you might be taking.
Thank you. And last question then, someone's put, I've missed your email address. Could you show it again, please? Because they want to contact you. That's a challenge, isn't it, for you now?
Thanks, Pete.
I think it'd be the back. Would it be the back
I would
bottom?
just say, note the spelling of Kathrine. There's no E in it.
Lovely. Well, thank you very much, Kathrine. Very enlightening.